Happy Monday, everyone. Good morning and welcome to day 36 of our Vine Health COVID-19 updates. These updates are meant to bring you news, factual news about the COVID-19 pandemic over the last 24 hours, and then just to talk about general tips to help you survive this lockdown period and the pandemic period, and to help you thrive as well. So that's what we're here for. I hope you're all doing well. Just to refer you back, we don't normally don't have an update on Sundays. It's meant for your own reflective practice. It's meant for your own spiritual practice. So I generally don't have an update then, but that's our day 35, and then today's day 36. But I'll ask you to sort of watch back Wellness Saturday, where we talked about skincare and a few other things, and also particularly our Money Friday, where we talked about how to sort of improve our financial health and just thrive during this time. So yes, it's Monday, goodness, and today I've just sort of titled it Parenting and Mental Health. Is a new week and the new term for those who have children. How do you work from home and also help your children and actually retain your own sanity while doing that? So if you have good tips on working from home, parenting, feeding them, making sure they're on top of their schoolwork, and still being your own authentic self, do let me know, because honestly, I think it's quite tough. It's tough for everyone. So what's happened in the last 24 hours? So, all sorts of things have happened, but the good thing is, up until yesterday at 5 o'clock in the United Kingdom, start from the United Kingdom this time, we had an increase in the number of people who lost their battle to this terrible, terrible illness. And now it's gone up to 16,060. That's up by 596. And actually 596 is the smallest increase we've had in about 2 weeks. So while each of these numbers are people, they are persons with families, with lives, with stories, and our hearts go out to them. Looking at the bigger picture of the pandemic, we just say, well, we hope for a downward trend. Sometimes over the weekend, it's a bit different, but we hope that this continues as it's continued in some other countries. So 596, which is a positive. So it means that the doubling time has now even increased to 12 days. Whereas before, the number of fatalities was doubling every 2 to 3 days. It is now increased to 12 days. So that means that we are definitely going through this pandemic very quickly, and hopefully, we hope that things will start to get better and we stop losing so many people to this terrible, terrible, terrible illness. So that's up until yesterday. This is hospital deaths. This does not include care home deaths, which is a whole other kettle of fish. But with the hospital deaths, it's up by 596. And the other thing about the United Kingdom is that the furlough applications open today. If you don't know what that means, I'm sure everybody knows. But for those who don't know, it means that if your workplace has said that they cannot pay you, or you're at home because you are not able to be paid, they can apply for up to 80% of your salary, but that opens today. So if you have a workplace that is not on the ball, give them a call, tell them to apply for the money, because you can get up to 80% of your salary with a top cap of 2,500. Nobody has to let anybody go. Nobody has to lose their job, because the government has said they will pay your salary. I think it's for 3 months. And so the April salary is due to be applied for today. So if you're home and you're lucky enough to have to work and you can be doing other things, but you still keep your employment, remind your superiors to apply for your money today. The quicker the better. So that's what's been happening in the UK. The lockdown is still going on. We have another 2 weeks or so of it. And everybody's thinking about the exit strategy. People are sort of wanting to know how they come out of this. It's interesting that people are really interested in going back to normal despite the pandemic. It's interesting that what makes us healthy is not just our health, our safety in terms of our health, but just being able to work and go back out there. In the United States, there's been just so much drama in the US, and I just feel so bad for the United States at the moment, the kind of attention that they're drawing is very negative, and that's not the kind of attention that you want a so-called world superpower to draw onto itself. And I question the fact that, is America still the world superpower? I mean, what do you think? I don't know that America is still the world superpower, even though they're still giving a lot of money to many projects, but the way their image is coming across is really, really sad. And there's been many protests in many states in America that they want to reopen the economy. And the president is then sending messages supporting the protest, saying that everybody has a right to protest, and there were social distancing during the protest, so it's okay. I do not think that the protests are quite right. I think there are other ways to raise this. Them all going out en masse like that will just spread the disease even more. But that's what's going on in America. The number of deaths in America is now over 40,000. I mean, that is not good. Although they're still saying that it's still dropping in terms of the fatalities. But honestly, it's over 40,000. To think that about 3 weeks ago, if I remember correctly, it was 2,000. And now it's over 40,000. I think that's absolutely just shocking. So the United States, our hearts are with you. We're all trying to survive this. So let's keep doing whatever we can to get better. And then just to talk about Nigeria, shockingly, when I spoke to everybody on Saturday, the number of cases was at 493. And I said I was going to keep my eye on Nigeria and see what the cases were going to be doing like in a week. But surprisingly, next thing I know, yesterday, the cases have gone up to 627. And I'm not sure why it's gone up so rapidly, whether it's the fact that there's more testing being done, or whether it's that it's spreading. I don't know. But if you're in Nigeria and you know why the sudden increase in the number of cases is, do let us know, because it's gone up to 627 from 493. And my concern is that, will this then double? Will this keep going up? Number of deaths is 21. 170 people have been discharged. It's still not like other parts of the world, but I was hoping that it wouldn't go up like that, because again, we do not want a pandemic in Nigeria or an epidemic in Nigeria, because it's just not the place for epidemics because of the density, the poverty, the lack of social amenities. So, well done to the NCDC and for everything that they're doing to contain this. But we are going to keep a very close eye on the numbers in Nigeria. I won't stay too long today. I wanted to talk about parenting during this pandemic, and because it's the first day of term for many schools, parenting and your own mental health. Normally, we're able to ship our children to school and we go off to work and we don't see them for 7 hours or so every day, and then they come back home and we just check their homework. Now they have to be around the whole time, and then you're getting this deluge of emails from school. You have to keep on top of your own work. You have to keep on top of their work. I mean, how are you coping? I mean, I have a few tips. I'm not saying I'm an expert. Believe me, I'm struggling as well. But one of the things that I've sort of devised over the weekend is having a schedule, and how do I schedule, making sure that the children have their own workspace. I have my home, because I work from home on Mondays, which is great. Have my own workspace. We all have our spaces, and that they are doing their work and they're on top of their work. Otherwise, this would drive anybody crazy. So my suggestion is that, you obviously have a schedule. Everybody has their own space, and that you actually keep an eye and make sure that their homework is getting done all the time, depending on the ages of your children. I think for some people, their kids are sort of 15 and over that, and they're able to self-motivate. But there's some children that cannot motivate themselves, and you have to be on top of them. That's what the teachers have been doing for you all this time. Now you have to do it yourself. How are you coping? What tips are you using to get these children to get on top of their work and not fall behind? Now, one of the things that has been said is that many children are going to fall behind because, people are not able to monitor their work, or they don't have the right equipment at home to get the work done. They don't have a laptop or a desktop. How do we make sure that these children don't fall behind? So I would suggest that you have your own space, you have your own boundaries. Let them know that you're working if you're working from home, so they don't just come into your workspace. Give them their own jobs and their own responsibilities. They have to chip into how the house is being kept and how things are being upkept. And if you have any other tips about that, just let me know. But again, I thought I would bring a really nice, short, sharp update for you today. I hope you're finding it helpful. As long as you find it helpful, I'll keep doing this until we come to the end of this pandemic, or at least until things start to improve. But happy Monday, everyone. I wish you all a fantastic week. Send your questions and tips, comments, feedback, anything that you want us to really tackle. Just let me know and we will talk about it. But again, I will see you tomorrow. If by God's grace, see you tomorrow, and we'll keep updating each other. But send your questions, put your tips in, and thank you for watching. Like, share, follow, just spread the word, and we'll keep going. All right, everyone. Bye.